But with that, I would yield 5 minutes to the gentlelady from Texas, Mrs. Escobar.
Thank you, Mr. Chair. I'd like to thank the witnesses for their testimony before the committee today. We are closing out business in the House Judiciary Committee this Congress with a hearing that's meant to set the stage for the continued hostility we can expect next Congress toward reproductive health care. Not content with undermining abortion access across the country since the fall of Roe, my colleagues across the aisle continue their attacks on the right to safely seek reproductive care in this country. Let's remember that the reason the FACE Act was enacted at all was in direct response to escalating violence by the anti-abortion movement on abortion patients, clinic employees, and providers. And I want to be very clear, I stand firmly against all violence. I don't condone any threats or intimidation. I introduced the Healthcare Providers Safety Act earlier this Congress, which would amend the Public Health Service Act to authorize grants to healthcare providers to enhance the physical and cyber security of their facilities, personnel, and patients. My bill would give providers the needed resources to ensure the safety of patients and that providers are able to continue providing essential reproductive health care. Reproductive health care providers, patients, and facilities are frequently the targets of violence and harassment, ranging from vandalism to online harassment to stalking, arson, and deadly attacks. Our providers deserve to care for patients, and patients deserve access to abortion care in safe environments. Ms. Waters, how can Congress build on the protections created by the FACE Act, and what steps can Congress take to improve or strengthen protections for patients and providers? And what other effective, or are there other effective methods to combat routine harassment and violence like the kind experienced by providers and patients at healthcare clinics?
So I think it is important to note that while FACE does provide an important federal remedy that I would argue to your question that Congress needs to zealously protect, it does not preclude states from also enforcing remedies in their own state, right? So we need both of those things, and we can hold both things. Both things can be true, right? So I think it's incredibly important that Congress send the message that if someone is providing legal health care, which abortion providers and other medical professionals are in the majority of the states, they will be protected. They don't have to fear liability. They don't have to fear violence. They don't have to change their medical practice to try to comply with ever-changing laws. That's a message that Congress can send.
I want to tell a very quick story to give voice to a number of constituents who reached out to me after the reversal of Roe. I heard story after story about women who were forced to terminate pregnancies because of the lack of viability of the fetus. And many of these constituents had to access their care at a clinic. And as they were mourning the loss of a child they badly wanted, but a fetus that if they carried to full term would threaten their own life, creating motherless children in their family, they had to walk. I heard stories about women having to walk past crowds of people screaming at them with photos that they did not want to see in that moment as they were trying to save their own life and be around for their other children, and could not adequately even mourn the loss of their baby's life because they were spiraling into shame because of what was about to happen. I think it's really important that these women's stories be uplifted, which is why I wanted to share it with all of you today. Ms. Waters, thank you so much for your response. I appreciate it. I yield back.